All right. Good afternoon, everyone. Thank you for joining us. We appreciate it. We have with us today, we have Dr. Jim Carden, who's our Chief Clinical Integration Officer. Joining Dr. Carden is Keith Grant, APRN, Senior System Director of Infection Prevention, as well as Dr. Ulysses Wu, System Director of Infectious Diseases, all for Hartford HealthCare. So thank you to our experts for joining us and to members of the media for joining us as well. We have quite a lot of you joining. So we're going to let Dr. Carden kick it off here, and then followed by Keith Grant and Dr. Wu, and then we'll open it up for your questions. Dr. Carden, take it away.
Hi, thanks everybody for joining, and appreciate your continued attention as we continue to move through our efforts to control the pandemic. It's an important day. As you know, we've made good progress in this state and across Hartford HealthCare in terms of our vaccination, which we firmly believe is the most effective way for us to bring this pandemic under control. And as we've talked about multiple times, this has always been somewhat of a race for us to get ahead of this virus before it continues to mutate into strains that become more difficult to manage. We've made, like I said, good progress in partnering with the state and the other providers to really do a good job. The last piece is always the hardest, and we are venturing into trying to get the last group of folks who need to be vaccinated to ensure they're safe. Hartford HealthCare has taken the step to clarify our plans to make vaccine mandatory for all those who work for us in Hartford HealthCare. This is a responsibility we feel we have for the patients we serve. Vaccination helps not only keep our staff healthy, but importantly, helps reduce the potential that we expose those who are at risk to getting this lethal virus. So as we move forward, we have made great strides in ensuring that we are educating and providing broad opportunity. But it is important now to take the next step, much like we did with flu, suggesting that in order to fill our responsibility to our patients, to do the safe thing, to do the right thing, which are core values for us, it is important for us to get everybody vaccinated who is going to be working for us here. So our plan is to ensure that everybody is fully vaccinated by the end of September. That means that we will have work to do over the next weeks to months to ensure that everybody has that opportunity. We have plenty of access. We have plenty of vaccine. We want to make sure there are no barriers. We will continue to provide information and opportunities for those who have concerns, have questions, or remain uncertain, that they have ample opportunity to work through those and to work with clinicians and others to sort of get those questions answered. Just like we do with flu, we do allow people to apply for an exemption, and those exemptions will be considered and granted on a basis as they come through. But our expectation is that unless there is a compelling and important reason that we expect you to be vaccinated. If not, if you're not going to be vaccinated, by that time, the end of September, there could be consequences, including inability to work for us here at Hartford HealthCare. So we make that entirely clear. Like I said, we have a good experience of doing this with flu vaccine, which we've done for several years. And this is as if not more important for us to be very diligent about getting that done. I'm going to turn it over to Keith and Ulysses, and then before we open up to any questions.
Dr. Carden, thank you for that. We appreciate that introduction. And Keith and Dr. Wu, if you can both kind of delve into the science behind this and some of the data and why this is so important that we take this step.
Yeah, absolutely. So science, I mean, the good news is we've had over 300 million individuals being vaccinated, at least on our shores. Globally, the number is significantly higher. So we have good scientific data to support efficacy and safety for the vaccines at this point in time. And I think one of the most alarming numbers for us and significance in this decision-making process is well over 99% of individuals that's died and being in critical care over the last 2 weeks, specific in this data, specific over the last 2 to 3 weeks, are individuals that have not been vaccinated or have not been fully vaccinated. So from an epidemiology perspective, we're looking at two subset population in the US right now. In speaking in Connecticut, in the state of Connecticut, two subgroup of population, which is those that are vaccinated and those that are not vaccinated. And, you know, for especially with the Delta variant, it is clear that at this point in time, for many individuals, especially individuals with certain comorbidities, on July 14th is as close to March of 2020 for these individuals. The risk is still that high. So we need to ensure that, you know, as a healthcare institution, that I think have done very well in collaborating with the state and ensuring that we're in a much better position. We stand by the decision, and the decision which is supported by CHA strongly, that, you know, we will encourage that all our colleagues get engaged in the vaccination process. So, Ulysses, you're on mute.
That mute button. I was talking this whole entire time for 20 minutes. No, I'm kidding. All right. Science, I agree with everything that's been said. I'll keep it short. The science is very clear at this point. You may have seen the charts that, well, let me go back. The purpose of the vaccine is not to prevent disease. It is really to prevent transmission, to stop people from being hospitalized, and to stop deaths. And we want to take a potentially lethal disease and make it a normal disease. You may have seen the charts where in Britain, where cases are increasing, but deaths and hospitalizations are not. It's still flat, maybe increasing a little bit. And that is part of the science that is behind it. As Keith has already said, most of the people that have been hospitalized, most of the people that have been dying, 95 to 99%, are unvaccinated. And if we want to take a trip back in our hot tub time machine and look at the other diseases that we sort of have vaccinations for, this is our measles, this is our mumps, this is our polio. And back then, there were these same debates. There's really no debate about those diseases now. We want to take a deadly disease and make it normal. We want to turn it into the common cold.
Thank you all to the panelists for that introduction. We do have a question. We're going to take the first question from Tracy from the Republican American. Could you describe and name the specific medical conditions that would make it medically dangerous for someone to get vaccinated?
So I guess I can feel that the only main contraindication at this time is if you've had a previous reaction to the coronavirus vaccine. That is the only thing, and we're talking severe anaphylactic reaction within 4 hours to a prior COVID vaccine. Now, with the new data coming out about the Janssen vaccine and Guillain-Barré, we would certainly exercise caution if you have a history of Guillain-Barré, but there still needs to be a lot of science that needs to be sorted out. If there is no history of Guillain-Barré, the benefits to the vaccine still outweigh any risks at that point. Keith, anything else that I'm missing?
Dr. Wu?
Yes.
Sir, could you say how often do we have a sense of what the percentage of people who have suffered a severe anaphylactic reaction to the vaccine might be? How often does it happen?
Keith, you probably know the numbers better than I, but it's less than 0.05%. I mean, we've vaccinated millions of people around the world. And the anaphylactic reactions have been minimal. Keith, do you know the exact number?
Significantly minimal, and it's also very consistent with at the last time we saw the data, over 85% of the individuals who had anaphylactic reactions to the COVID-19 vaccine does have a history of anaphylaxis, to include using an EpiPen. So we have, we've asked that individuals communicate very closely with their primary care providers, identify the risk to the individual who's administering the vaccine, so the appropriate precautions can be taken. But at this point in time, based on the numbers of vaccines or vaccinations that has been given worldwide, the numbers exceptionally small.
Keith and gentlemen, I wonder if I could follow up there. I found it interesting, Dr. Wu, that you said that, the only real medical condition would be if you have had an anaphylactic shock to the vaccine, which would suggest, sir, that you would need to, there are no medical conditions that would preclude a person from getting vaccine, since the reaction you describe would have to have occurred to a person who was in the process of, or who had just received a vaccination. Is that correct?
That is absolutely correct. There is a small carve out if you've had a reaction to any of the components of the vaccine, but that is fairly, that's small and fairly limited. So yes, you are correct. There are really no contraindications to getting the vaccine.
Thank you.
Hi, I apologize if I missed this, but what percentage of Hartford HealthCare employees currently have been vaccinated?
Currently, we're at about 75% of individuals engaged in the process of being vaccinated at Hartford HealthCare.
At least one dose, yes.
Yep.
And Alex, we're still collecting some data for folks who weren't vaccinated with us. So that number is, and we have been where we have been requesting that we get their notification if they went to one of the other places to get vaccinated at their convenience. We should be more complete, because that will now be required to demonstrate that you have vaccine, so we have it on record. So that number is going to be continuing to move somewhat.
Do you worry that some people will leave rather than get vaccinated?
We hope not.
Yeah, we hope not.
Definitely hope not. Like, this isn't designed to alienate anyone at all. It's not designed to, in any process, we're hoping that we will, if anything, have people being more encouraged to be a part of health systems and in healthcare within Connecticut. I mean, this is not just Hartford HealthCare's initiative. This is a state initiative as well. So we definitely, we hope not, but it's certainly possible, and I appreciate individual beliefs. But we're in a very good position at this point in time when you think about efficacy, safety, and the science of the vaccine. So,
do you guys have a sense? Sorry, Tracy. Do you guys have a sense of why 25% of employees haven't been vaccinated? Is it similar to what we hear about in the general population? Are there specific reasons, or what do you hear from your colleagues?
Yeah, I think that's the correct answer. Our demographic, although Connecticut is different and maybe even Hartford HealthCare is a little different from the rest of the country, it still follows along the same lines. And so most of those demographic reasons that you've heard, they're very similar. I don't think there's anything unusual, peculiar about Hartford HealthCare resistance to vaccination as compared to others.
I guess it's just interesting because I believe it's more than 80% now of Connecticut adults have had one shot. And so for the rate to be even lower among people who work in a medical setting, is kind of counterintuitive. Why would that be?
I'd have to look up that Connecticut number, to be honest with you. That seems a little bit high, but so I'll get back to you. I'll let the my two smarter cohorts talk about it while I look that up. But that does seem high for Connecticut.
Yeah, I do. Alex, it's a good question. And one of the things that we talked about even before we got to this point is there's individuals that will have a significant amount of information that will decide not to get the vaccine. There's individuals, there's other groups that will not have the right amount of information that will decide not to get the vaccine. It's our responsibility to ensure that they have not a significant amount of information, but the right information, which is important. So one of the things that we've been doing a lot of is town halls. We've been doing a lot of FAQs. We've been doing a lot of working with individual departments to understand the needs and access, creating access points within the health system in order to facilitate, effective processing, delivering vaccines. So there is obviously still some unanswered questions. But again, keep in mind, a lot of the team or colleagues and our teammates have gone through an extreme process in managing the pandemic at a point where a lot of individuals were allowed to, work from home or are being in situations where they're not as exposed. So we have a number of things, a number of factors that we're managing, and we have to be very appreciative and sensitive to at this point in time. But we have some true heroes in the health system that have done a wonderful job in managing this. And it's our job to ensure that
61.8% are fully vaccinated.
But that's the total population. I was referring to 18 plus. It's 80.1%.
Oh, gotcha. You're right. Okay. Thank you.
I appreciate it, guys.
I wonder if you could discuss, I want to make absolutely sure. First of all, I believe it's 28,000 employees at Hartford HealthCare. That's your staff number, I believe. And secondly, I want to make absolutely sure that those people who do not comply will be terminated. Is that correct?
It is one of the outcomes. There is, yes, that is the potential is if you are not vaccinated and don't comply without the ability to get an exemption, then termination would be the consequence there, the final kind of consequence. We certainly hope that's not going to be necessary, but it is similar to what we've done with flu vaccine. It's the exact same process we've had in flu vaccine for some time.
And nobody seems to object, sir, with the flu vaccine. Everybody rolls up their arms. And to your point, Dr. Wu, I didn't see people running away from the polio vaccine or the measles vaccine. Quite the contrary, they seem to rush to get it. So what happened here? What has happened in the country such that we have so many people who, instead of rushing forward to the vaccine, have melted away?
Yeah, so if you have 4 hours, I could certainly give a dissertation on, what the society that we live in, social media, the spread of the news cycles, all that stuff. That all factors in. Factor in further echo chambers that we live in, our circles, our Venn diagrams that we all live in. There's multiple reasons. I do want to go back to the point. We do have people that run away from the flu vaccine. We actually, and we do talk about it, and we have committees to address that. But you've seen, maybe not with coronavirus, but some of the parallels that you'll see. Measles vaccination rates are going down, including measles and mumps. There is a certain demographic that this actually, that it's sometimes typically goes with. And so we are doing our best to try to educate. Yeah, you're right. Back in the day, when there was a vaccine, people rushed to get it, but it's different now for a multitude of reasons, as I pointed out.
We have a question from Nicole Leonard from WNPR. Nicole, you're up.
Hey, Tina, thanks. I just had a couple of quick clarifications. When we talk about staff and the mandate applying to staff, are we talking about all staff of all levels at Hartford HealthCare or just patient-facing staff?
All.
Everyone. Okay, great. Thank you. And I did want to go back to, because I know that other vaccines are often required usually during the hiring process to work at a hospital or during the employment, like the flu vaccine every year. Just out of curiosity, does the hospital track, is the flu vaccine recommended, or is that a mandate at Hartford HealthCare? And do you guys track year over year as to how successful it is every year to get staff vaccinated for the flu?
Yeah, it is mandated, and we do track it every year, and we have a very good, I don't know if success rate is the right answer, but we have a very good compliance rate with the influenza vaccine, with a smattering of exemptions that are legitimate, for the most part medical.
Got it. And one of my last questions was when we talk about why people might not have gotten the vaccine yet at Hartford HealthCare, has the hospital done anything to try and figure out if there are differences based on the level of positions people hold? Because I know patient-facing positions, they may have access to more of the scientific information and things like that, whereas other people in other positions and departments may not. So I was just wondering if the hospital, you know, if you're noticing trends based on where someone might work or their scientific background, as opposed to why they may or may not have gotten a vaccine.
Absolutely. So there's been, I think, a lot of effort put into this. There's a lot of data that we've looked through. There's a number of conversations that's been had. There's, as I said, there's a number of town halls. The data itself from multiple layers, not just from Hartford HealthCare, but from the overall community. We've had opportunities to collaborate and have discussions with other health systems, with other healthcare providers. We've had epidemiologists collaborating on the data that we do have, just to see if, you know, there's something from an angle that we're not seeing things from. And the overall result or overwhelming result is that there is there's just individuals who have certain beliefs and have certain level of data and been exposed to certain level of information that you know, we start out by trying to combat and providing certain level, another set of information. And at this point in time, the mandate, you know, and this is again in accordance with a collaborative with CHA, the mandate with Connecticut Health Systems, not just Hartford HealthCare, is going to be the mandated vaccine.
We have another question from, I don't know who this is, F17D48. It's a series of numbers and letters.
Tina, hey,
identify
Tina.
yourself and ask your question.
Hey, Tina, it's Dave.
Hey, Dave.
Hi, Dave. Go ahead. Dave, Altamari, CT Mirror.
Was kind of just answered a little bit, but I was curious of the 25% that have not been vaccinated, if you have any kind of a breakdown on that. How many of them are, you know, clerical staff or other staff, or what's the racial breakdown? Is there still an issue with people as far as a race issue, as far as not wanting to get the vaccine? Don't know if you have any kind of numbers on that. And I was just curious, just in general, I know you didn't really address this, but what are you seeing in the hospital now? Are cases increasing at all? We've seen a slight increase recently in our total numbers. I mean, obviously slight right now, but clearly trending slowly upward. Do you guys see that continuing? Sorry, two different things there.
So yes and yes and yes, I think. So the demographics I'll talk about really quickly, and then Ulysses and Dr. Carden can jump in. So demographics is very consistent with the community demographics, not just Hartford HealthCare and Connecticut community, but I think communities across the country, very similar. We do have a breakdown, so that's a yes, and then that's the explanation of the breakdown. With the increase itself, I would say we do, you know, we're experiencing an increase, I think, throughout the state. One of the things that we should keep an eye on, the actual prevalence rate is, you know, this is the first time in a very, very long time, in weeks, that we're prevalence rates over 1, right? So I think it's 1.38 or 1.48 today. That's very concerning for a number of reasons. We have an idea as to why, right? So we have a new variant that the B1617.2 that is now, it is more contagious than the prior dominant variant. And in the state of Connecticut, for new cases, the new variant, the dominant variant is the Delta variant for new cases. And that's something that we need to keep an eye on. And again, I said it before, is our biggest concern is that we do have a population, 2 sets of population now in Connecticut from a risk mitigation perspective that we really need to communicate to and focus on. We have a group that's not vaccinated, that's very high risk, that's now dealing with a virus that's about 40% in many studies more contagious than the virus that got us to this point of talking about a pandemic. So we're in a very, I think, a very sensitive point at this point in time. Ulysses, anything to add?
Yeah, our data actually supports the power of the vaccine at this point. So the percent, as Keith alluded to, the percent positivity rate is increasing, but and the cases are actually increasing. But I'm looking at the data right now compared to June 1st, where we were in the triple digits for hospitalizations. We've actually been hovering, and this is for the states, by the way, we've been hovering around 30 to 40 hospitalizations for the last month at this point. That has actually not changed. It's been going up and down a little bit, but these are what I've referred to on some of my other talks, small Jersey shore waves and not necessarily Pacific waves at this point. And the same with the deaths. We've been hovering, the last time, our last big death spike was on June 7th, and we had 7 deaths, unfortunately, on that day. But since that time, it's all been less than 3 at this point. And so deaths, hospitalizations, and the vents have actually, for the last month or so, have people who have been requiring ventilation have all been between 2 and 4. So speaks to the power of the vaccine. Cases may be increasing, but hospitalizations, deaths, ventilation, for the most part, remaining flat.
Tracy, go ahead with your question.
Yeah, so my question has a bit to do about what you have said, what Dr. Carden has said, and I believe what Dr. Wu has said about the Delta variant. Firstly, Dr. Carden mentioned that he said, we want to get ahead of this virus before it mutates into something that becomes almost unmanageable. Dr. Wu, you said, sir, that you want coronavirus to become like the common cold. So one of the questions is, will the virus continue to mutate until effectively we run out of the Greek alphabet and, need to invent a new one? Does it keep getting worse and worse and worse? Well, let me start with that one. And the second part of that would be for you, Dr. Wu. Could you, how would you explain this kind of normalization of COVID such that it is parallel to the common cold, sir?
Yeah, sure. I'm going to start with one of my favorite my favorite Taylor Swift sayings that I know Keith loves, and it's the saying is a virus is going to virus, and so its job is to mutate. It's going to change, and one of the beautiful things about the technology of this vaccine is it does allow us to adapt very, very quickly and create new vaccines. And so, are we going to run out of Greek letters like hurricane season, like I think that we had last year? It is a possibility, but it doesn't necessarily mean it's going to be more dangerous. We hear about the Delta virus, and certainly it is more dangerous, but more dangerous in the sense that it is more transmissible at this point. And it is that transmissibility that we worry about. The whole point in vaccination is to decrease transmission. And if we can decrease transmission, we are decreasing replication, and we can sort of extend our shelf life on those Greek letters to a longer period of time. But yeah, I'm not going to sit here and say it's all puppies and rainbows and that the coronavirus is going to eventually go away tomorrow. That is the eventual hope. But the more people we can get vaccinated, the slower we can replicate, the slower a virus is going to virus, and the slower or the longer we're going to hold on to those Greek letters. Keith?
Yeah, I mean, I like the Greek letter example, but I can tell you, if you look at the actual mutation so far, we've already been out of Greek letters. I mean, the thing is we haven't really been assigning Greek letters to all the mutations. I'll give you an idea. Right now, we've started to implement a process of sequencing at Hartford HealthCare, working very closely with Jack's lab, which give us the capability to manage internally or patients that are positive COVID-19. So I think this is excellent for the community. It's a good collaborative with Jack's, and it's a good ability for Hartford HealthCare to provide the appropriate numbers and epidemiological support to our healthcare community and our broader community. With that sequencing, the mutations that are available at True Jack's is about 1,280. So gives you an idea. We're kind of out of the Greek letters, but we haven't been assigning the Greek letters to all of them. So, but I like that example.
Any other questions? We have just another minute or so left. Any other questions before we wrap up?
Dr. Grant, you said doing this genomic sequencing with Jack's. Do we have a percentage of so far of the cases that you have that are the Delta variant? Do we have that yet?
We don't have enough data at this point,
Okay.
but very, very soon. I'd say within 2 weeks, we'll have enough data so we can talk more about what we're seeing.
Thank you.
It's a good question.
All right, doesn't look like any other questions have come in. Dr. Cardin, Keith Grant, Dr. Ulysses Wu, thank you so much for joining us today and for obviously all of the media attending and asking questions. We hope you have what you need. If not, you know where to find me. Thank you all. We appreciate it.
Thanks, guys. Thank you, everybody.
Bye-bye.